On the Medical Watch, a corkscrew for the brain. Medical reporter Dina Baer explains it's a new device designed to treat stroke patients, giving them more time for treatment with less chance for permanent damage.
All of a sudden I had a buzzing in my ears, and the next thing I knew I was on the ground.
66-year-old John Maliff runs and plays tennis 3 times a week. Then, 3 weeks ago, he dropped down in his garden.
But I couldn't speak, couldn't move the right side of my body.
The clot-busting medication, TPA, was given within the 3-hour window of John's stroke, but it was not dissolving the clot in John's brain.
There is complete stoppage of blood going to the back of the head.
John's symptoms got worse, and soon he stopped breathing. That's when doctors at Central DuPage Hospital went after the clot with MERCI.
That we can retrieve the clot that's lodged within some of the distal arteries in your brain.
This is animation of the MERCI corkscrew retriever, which is threaded into the artery and advanced to lock onto the clot.
Once the clot is engaged, you retrieve it by pulling the device back.
This is how it looks in action inside the brain.
You can see the corkscrew coming down, and that's it. That's on its way out.
The procedure occurs within seconds. Watch again in slow motion as a blood clot is not dissolved, but literally pulled from the brain and safely stored inside a catheter so it doesn't break up in the artery. The proof of efficacy? Look at the latest scan.
There is flow now going to the back of the brain.
And now listen to John describe the difference just hours after the MERCI procedure.
That night, I was in bed, but I could talk and move.
Very grateful.
The MERCI retriever extends the treatment window after stroke from just 3 hours to more than 8. On the Medical Watch, Dina Baer, WGN News.
It's amazing, Dina. Thanks very much. Siberian iris.